Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers, producer of Public Health on Call. September is National Food Safety Education Month. In observance, we welcome to the podcast Cari Sledzik, an epidemiologist in the Office of Acute Communicable Diseases at the Baltimore City Health Department. She talks with Dr. Josh Sharfstein about how she investigates foodborne illnesses. She also has some great tips for staying safe at the end of the interview. Let's listen.
Cari Sledzik, thank you so much for joining me here on Public Health on Call to talk about what a health department does to keep our food safe.
Hi, Josh. Yes, thank you for having me. I'm very excited to chat about what we do here at the health department.
So maybe by way of introduction, could you explain a little bit about your educational background and how long you've been working for Baltimore City?
So I went to school, got my master's degree in public health at Tulane University. I was in the tropical medicine department down there in New Orleans. It was a lot of fun, but I learned a lot. After that, I did maternal and child health in West Virginia and got kind of into infectious disease in Calvert County for a short spell. And then I've been at Baltimore City Health Department for a little over 2 years now. And here I'm an epidemiologist in the Office of Acute Communicable Diseases.
So when there's a report of foodborne illness, it will cross your desk one way or the other.
And it's usually in the form of what we call an electronic lab report. So it's an automatic report that comes from the lab. Oftentimes we'll get it. It's almost instantaneous. It's that electronic lab report. So sometimes we might be calling people before they've had a chance to talk with their doctor. So we do sometimes have that first that first conversation with someone.
So just so that I'm clear, somebody gets sick somewhere. They usually have maybe gastrointestinal symptoms like diarrhea.
Diarrhea, vomiting, abdominal cramps. They might have a fever too. And so they seek care at an urgent care. It doesn't have to be at a hospital. We still get the results when it's an outpatient setting. They might go to their primary care or their gastroenterologist and get testing done. And it's that test that kind of triggers an alert for us in the office.
And what does the test have to show for it to go to the health department?
There's a list of specific communicable diseases. It's actually in the Code of Maryland regulations. It lists out. So I'll give a couple examples. That could be Salmonella, Campylobacter, a very specific E. coli, a Shiga toxin producing E. coli. There's a couple others as well, but the Salmonella is probably the one people are most familiar with. We also get Listeria. There've been a couple instances of Listeria popping up in the news recently. We also investigate those, and when those test positive, that's the alert that'll come to us.
So someone gets sick, goes to the doctor or clinic, gets a test. The test shows one of these communicable bugs, and you get alerted. What do you do?
So at that point, with the lab report comes contact information. And so there's usually a phone number. So we'll call, say, hi, I'm Cari with the Baltimore City Health Department. I'm here to talk to you about a recent illness. Do you have time to talk? And we want to be mindful that people have busy lives, but we do need to do our jobs and see where exposures might have happened. So we conduct an interview. It's a standard interview for everybody. So everybody who has Salmonella gets the same interview. Everybody with Campylobacter gets the same interview. It's the same for everybody. And so we'll talk about places they've been, travel. Campylobacter is known as traveler's diarrhea for a reason. It can be associated with travel to different places. Of course, the big one with these gastroenteritis like illnesses is foodborne, food exposures that they've had. So it could be restaurants, festivals, private events, maybe catered events or potlucks or parties, and then also food that they've eaten at home. What do you normally eat over the course of a day? Or did you have any new foods recently?
And presumably, if there is an outbreak, you might be getting multiple reports, and it's your job to piece together the common factor between people.
Right. And it's not just us either, because here in the city, people in the counties will come into the city for restaurants or events or what have you. So we do have close contact with our neighboring jurisdictions, and we do coordinate with the Maryland Department of Health. They might get reports from other jurisdictions. So we do keep in close contact because people, of course, come into the city and eat food here as well.
Got it. So let's take an example where you get a case, their case is going to the county, their case is going to the state, and you're able to piece together that it came from, say, a restaurant. What happens next?
So at that point, what we do is, if we've already associated it internally with a restaurant or a risk, we'll contact our environmental health office, and they're the ones that go and do the on-site physical inspections. And so what we do in acute communicable diseases is we gather the information. What did each person in the party eat? And that includes people who, say it was a group of friends who went to a restaurant. We want all the food that the ill person ate, but also the not ill person, because that can help environmental health kind of narrow down where in the restaurant they need to look, what food items they need to focus on, et cetera, because all of these pathogens have particular food items that they do tend to, not always, but they do tend to be associated with. And so we'll provide that epi information that we've gathered from the cases and non-cases and share that with environmental health. They go and do a specific complaint-based inspection. That's in addition to the regular inspections that they're always doing on a routine basis. And so if they discover things that are in violation, if things can be corrected on site, great. If they need to return, they'll do that to make sure that things have been corrected. Over the course of that time, it does take a little bit of time to do that. So we might get additional cases in the meantime, additional people who are ill. And so we use that information to further refine our information that we've gathered.
So what would be a relatively small outbreak? How many people affected?
So our threshold is actually just 2 people who are what we call not epi-linked. And so that's kind of a big loaded term. What it really means is that these are 2 individuals who don't live in the same household, wouldn't be considered close contacts. This is like the only discrete meal that they shared in like 72 hours. So it really can be as small as 2 people, and it can be as big as unfortunately it can get.
Like, how big is big? What would be like a big outbreak?
I'd say maybe a dozen, but I don't have quite. Thankfully, we don't see them that often to know. Like I said, I've been here 2 years, and for the vast majority of them, they're quite small. So thankfully, it's not too big.
And talk to me about the foods that wind up getting identified. What would be examples?
So examples of food might be undercooked meat, or produce is very often identified. People might have heard, I believe it's salmonella outbreaks associated with romaine lettuce. Those typically hit the news pretty frequently. Ice cream with listeria, dairy products with listeria is pretty, I don't want to say pretty common, but that's an association that you'll hear about. Our E. coli's, also meat, could be produce. So it's really those undercooked meats. Another classic one for timeliness, or I should say seasonality now, 'tis the season for people to be eating raw seafood. The raw oysters are a big classic exposure for non-cholera Vibrio. So we do see those as well. If there's one piece of advice that I have, it's please don't eat raw seafood. I know people want to eat their steak rare at the very least. If we can avoid the raw seafood, that would be a healthy decision.
It would lead to fewer calls to you, it sounds like.
Yes. Yes, I did have one case who did say that, we're going through all of the raw seafood, because the Vibrio cases they're a little different because it's so classically associated with salt water and brackish water, and so the seafood that lives in that environment as well. So we're going through raw fish, cooked fish, raw mussels, raw clams, and going through that, and they say, well, I do eat raw oysters a couple times a week. And then in your head, you're like, ding, 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 there you go. that could be it.
So let's talk about what happens when you do figure it out, and what are the consequences for trying to protect from more people getting sick. If you figure out that it's undercooked meat, what happens then?
So at that point, that's probably something that environmental health has spotted over the course of their on-site investigation. And so if there are practices that they're seeing not being done properly, if dishes that were carrying the raw meat or what have you, or utensils were being mixed between the raw and the cooked meat, for instance, they'll correct things like that in the practices that are being done back in the kitchen.
I'm going to give you another scenario. What if you're investigating a case and you realize that it's linked to a national recall, like there's a vegetable that's contaminated with salmonella? What happens then?
So the health departments like to get the word out when that is happening. If people were to have, say it's a frozen food item, hey, maybe toss out the frozen food item. That would be a good idea. Don't prepare food that might contain this particular food. So that there's a lot of communication that happens, and that happens at all levels. So it's not just local health departments that are trying to get the word out. State health departments will put out press releases. They'll try to get in contact with the local news as well. And federal partners put out communication. You'll see things on social media as well, and national news when these outbreaks are occurring.
All right, here's another scenario. You figure out that it is a particular kind of food that was prepared by someone in the restaurant. And there's a concern that maybe that person is actually passing it on to the people who are eating at the restaurant. Does that ever happen?
So it does. And what we do in acute communicable diseases is we have to follow state regulations. When we have an ill food service worker, or we have two other kind of big occupation groups as well, healthcare and daycare. So people working with very young children in a daycare setting, we do have to restrict them from work. That's my least favorite part of the job, because you're keeping someone from work. It's not fun, but we have to make sure that we're protecting the public and their friends and coworkers and everyone around them. So what we do is we restrict this individual from work. Say it's a food service worker. We'll keep them from work. They talk with their doctor. Maybe they need some treatment, but we do testing. And then for each particular illness, Salmonella has a particular set of criteria to be released from restrictions. Yersinia would have its own set of criteria for release from restrictions. When we can show that this person is no longer infectious, then they can return to work. And so we really do ask for the cooperation from the employer as well. We're letting you know this person is restricted. We retain their private health information. So we just give a general, this person is restricted. But we do want to give the workers some support there. And the testing that we do, they can do it with us. People who are restricted from work can seek their testing through their own provider, or they can seek it through us, and it's free from us. So we try to help out as much as we can in that scenario.
Great. All right, we're running out of time, but this is a chance to talk to the public about food safety. You've already given the advice to beware raw seafood. What else would you tell people in Food Safety Month?
So the FDA has kind of a classic 4-piece advice that I would like to add to if I can. They like the clean, separate, cook, and chill. And so the idea is with clean, I do want to add, you wash your hands, you wash your produce, you don't wash your meat. But I also would like to share that it would be a good idea to wash your hands before and after handling your pet food. We have seen outbreaks associated with pet food. These are typically illnesses that we can share with our pets and that we can get from our pets. So it's kind of a two-way street there. So I do want people to keep in mind that we need to protect our furry family members as well. So that it's something to add.
Got it. Well, Cari Sledzik, thank you so much for joining us to remind us not to take the safety of our food for granted.
Thank you, Josh. I appreciate the time.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.